Any minute now.
All right, welcome into our February GBMC Facebook Live. This is where we get to talk to the experts, really about topics that affect all of us. So today we are talking to Dr. Fong Liu, assistant professor at Johns Hopkins and in the Department of GYN Oncology at GBMC. And today we're talking about cervical cancer, HPV vaccinations, and really everything in between. We're so lucky that we get to talk to these doctors each month because this is your chance to ask any of your questions. We want this to be interactive. So we're hoping that people will jump on Facebook Live, send this link to your friends if you know this might be a topic they're interested in. And this is the time where you can ask your questions. I'll ask Dr. Liu for you, and we'll get those questions answered. So we're going to get some people on our Facebook page now joining in. Hello to everyone, and hello to Dr. Fong Liu. Thank you so much for being with us.
Thanks for having me.
So this is a really important topic. It's a topic that, I mean, cervical cancer, of course, affecting women, but HPV is something that affects men and women. So talk about just cervical cancer first. How many people is it affecting right now? I mean, it's really common, isn't it?
So cervical cancer, thankfully, is not that common because of great screening and great preventative measures that we have in this country. But what causes cervical cancer is HPV, and HPV is extremely common for any sexually active adult. It's really a ubiquitous thing, and the important thing that I like to counsel patients about and make sure that the public understands is that they go in for their routine screening, pap smears, and HPV testing.
Okay, so cervical cancer, not so much as common as you said, but HPV,
yes,
very, very common. I have
yes.
heard some statistics thrown out with HPV, and it seems like, I mean, almost, would you say most of the general population?
Oh, absolutely. Absolutely. And the thing about HPV that I think sometimes is difficult to understand is that, you know, there are over 200 different subtypes of HPV, and the vaccines that we have protect us against 9 of the most common strains of HPV that go on to cause the majority of things like genital warts and also cause most of the cases of cervical cancer. And so, yes, it is very common, but it can lead to some very, very serious consequences if you're not seeing your doctor regularly.
Gotcha. With the HPV vaccine, are you starting to see that more people are coming around to it at even a younger age? Has that been sort of controversial, how early we want to get people vaccinated?
Yeah, you know, the recommendation from the CDC is that both boys and girls, starting at the age of 9, can get vaccinated. It's recommended that boys and girls at 11 and 12 get vaccinated as kind of the ideal age. But the vaccine has really been around since 2006. And those of us who treat cancers caused by HPV, like cervical cancer, like vaginal cancer, like vulvar cancers, we really would love to see more of an uptake of this vaccine. And we wish it was higher than it was. And yes, it has been controversial.
Yeah, and is that because I feel like, you know, you talk about HPV, I mean, you're essentially talking about sexually transmitted disease.
It is.
In a sense. And is that, I'm assuming that's the reason why people are, you know, not wanting to get their kids vaccinated that young.
Right.
It's sort of like, you know, they're too young for us to even be thinking about that. But what would you say to those parents?
Well, I think as a gynecologist, as a GYN oncologist, my focus is on health. And we know that sexually transmitted infections, if we talk about them more, if we normalize them more as part of just, you know, your well woman, your annual, your routine screening tests as a way to keep ourselves healthy, I think it's really important to destigmatize it. And just because you're getting vaccinated for a viral infection that is sexually transmitted, it does not mean that then it gives, your child free rein to engage in promiscuous activity. That's not, that doesn't actually even come into the conversation. The focus is really about keeping yourself as healthy as possible.
Gotcha. We are getting some people tuning in. Thank you all for jumping on Facebook. Hi, Ivy, Anna, Denise. We're so sorry. She said my aunt passed away from that. Lauren Ridian, does the vaccine bring out an autoimmune disease like type 1?
No, no, it hasn't been borne out in the literature at all. Yeah.
Okay. Moderate dysplasia is the beginning stage of cervical cancer. Someone wrote in. Is that true?
So the thing about HPV changes, and I'm glad somebody asked about this, is that the way that it leads, the process to cervical cancer does take some time, and it generally goes through a process of developing abnormalities called dysplasia that are essentially precancers. And this is why still, even after getting the vaccine, and if, especially if you haven't been vaccinated, to see your gynecologist, to your general practitioner, to get pap smears and HPV testing, because what you want to do is to catch these changes before they actually turn and transition and transform into cancer. And so it's definitely very treatable at these precancerous stages. And this is, something that can only be caught by a visit to your doctor.
Right. We had a question that was written in ahead of time. So does a newly positive HPV test mean that my partner has had other partners while I am with them?
So that's a very good question. It's a question that I get asked a lot. And the answer is not necessarily. Because the way HPV infection kind of works, if you will, is depending on how well your immune system is working, you can clear the virus. It can also get reactivated. And so it could be from an exposure years prior that could cause a newly positive HPV test. And so again, the important thing is for the person's health at the time is to get evaluated for that abnormality, to get treatment if you need it, and then to also, again, get vaccinated. You can get vaccinated after even testing positive for HPV.
And if you were to get vaccinated after testing positive for HIV,
Or
talk about
HPV.
what that would help with.
So again, like I talked about before with the different types of HPV, you may be HPV positive for a certain type, but then getting the HPV vaccine, which covers 9 different types, can help protect you against the ones that you have not been exposed to. And just a few years ago, the FDA did approve the HPV vaccine up to age 45 for both men and women. So I encourage all of my patients under the age of 45 to get the vaccine if they have not already.
No, I feel like we're in this world where we're talking a ton about vaccines,
yes.
right? We're hearing a lot about the COVID vaccine right now, and everyone's interested in side effects. Any side effects that goes along with this HPV vaccine?
Yeah, definitely the most common are going to be your local side effects of soreness and redness around the injection site. Those are the overwhelming majority of the side effects that you're going to see. And I'm really actually glad that we are talking about vaccines, because I think it's really heightened the awareness the public has about vaccines and the availability of all of these other vaccines that we have to prevent disease.
I had a question come in. Is it safe for boys as well?
Oh, yes, absolutely. So again, the same ages, are approved for boys and girls. So you could start getting it at age 9 for both boys and girls. The recommended age by the CDC is ages 11 to 12. And then again, it is approved through age 45 for both men and women.
And I don't know if I missed this, but I believe at least some years ago, it was a series of shots, correct?
Mhm.
Is it
Yeah,
one vaccine? Is it a series still
it is still a series. It's a series of 3 shots
of 3 shots? And
separated.
how
Yep.
far are they spaced apart?
Generally about a couple months.
A couple months.
Yeah.
Okay, for those of us, or for those of you who are joining us right now, we are talking cervical cancer. We're talking a lot about HPV and vaccinations. Doctor, would you just go over some early signs of cervical cancer for those just joining us?
Yeah. So early signs would be bleeding, abnormal bleeding. So bleeding between your periods, bleeding after vaginal intercourse, abnormal or foul smelling vaginal discharge. Those are kind of the common early signs. Of course, pelvic pain is another thing that we see sometimes in later stages of presentation. And of course, changes to urinary habits or bowel movement habits are also more later stage symptoms of presentation. I do want to stress that the goal of screening is really to catch it before it is symptomatic, before patients will actually feel it, because oftentimes, most of the time, to be honest, when patients are already experiencing the symptoms that I talked about, there's already a tumor there. And so when we have a tumor there, then it's more advanced, and it becomes more difficult to treat. And the goal, because we have such good screening methods with the Pap test, with HPV testing, the goal is really to catch it before it gets to that point where patients are seeing symptoms. And we have reliable ways, and really no one in this country should be dying from cervical cancer.
Of course, I mean, who loves to go to,
The
their doctor,
gynecologist.
right? The gynecologist. It's right. It's not always the most pleasant doctor to go to, but should it be yearly for all women?
So so I want to distinguish kind of Pap tests and a visit to your gynecologist, because they're not the same thing. So the recommendation for cervical cancer screening, so Pap and HPV testing, is really to start at age 21. But I do encourage all women, and mothers to daughters, if they are, getting to an age where, patients are talking about birth control or contemplating sexual activity, to really make that appointment very early on, so that young women can get the education that they need about their own bodies, because that is one of the most pure ways of empowerment that we could give to young women, is really to know what the anatomy is, to know what the normal, biologic and physiologic processes of what is actually your period. Why is sexual activity, what can it put you at risk to in terms of infections, and how do you protect yourself in terms of from unplanned pregnancy as well as infection. And so I want to stress that those annual visits, are really about talking about, well, this is going on with my body, or what is normal, or, and understanding from a reliable physician, what's normal for your body, and kind of using that as a way of self-care, truly.
Yeah, it's so important for young women too to know that going to you guys. I mean, it's a safe place, and there's nothing you
Right,
haven't seen, and it can be a vulnerable feeling going in there, but it really
right.
is as you said, I mean, it's just so important to just have our young girls being educated early
Right.
on. So going back to HPV, let's say you get a positive HPV test, you have it.
Mhm.
Is there any chance of, can you ever get rid of it fully, or will it always be in your body?
So that's the answer to that question is dependent on a lot of different things. So it depends on the type of HPV that you're exposed to. Certain ones are tend to be more aggressive and more tenacious and hard-headed about not getting cleared by the body. It depends on what's going on with the patient's other medical problems, if they have any, if they have chronic conditions that predispose them to depression in their immune system. So on the one hand, yes, it is very possible to clear HPV infection, especially in young patients. But then if there's, chronic steroid use for, some sort of, medical condition, if there's, medications that need to be taken for immune modulators for patients who have like Crohn's disease or, rheumatoid arthritis, things like that, or patients with HIV infection who have organ transplant. Those are the types of patients that have a different kind of screening schedule because they are less likely to clear infection.
Okay.
Yeah. So again, I go back to, I know I sound like a broken record. I go back to, see your gynecologist every year, and they'll get an update on your medical problems and then assess risk there, because every patient is different and we have to see them as individuals.
Yeah, no, certainly it's hard to see into the crystal ball into the future. But I mean,
Right.
professors and doctors, the vaccine is overall still newer,
Mhm.
obviously newer.
Sure.
Um, do you think that in the future there's a way to sort of eradicate HPV with this vaccine years and years down the road?
I mean, I think if we were to look at, the historical evidence with polio, for example, yes.
Mhm.
I think the difference is that there are so many different types of HPV.
Right.
And so I do wonder that if we, get rid of the ones that are in the vaccine, will the other ones that are currently less common become more common? But at the same time, I think about the passage of time, the medical technology, will we then just add different subtypes to the vaccines that we administer?
Right.
And so I think there's definitely hope to greatly reduce the incidence of cervical cancer, in this country, around the world. But health, like everything else, is something we have to continue to be vigilant about.
Right. And I know certainly we're focusing on cervical cancer uh, in this Facebook Live, but there are long-term and really negative effects on males too who get HPV years down the road. I mean, cancer
Yeah,
is.
so it's actually very interesting. A few years ago, I was at my dental screening. And we're seeing a lot more HPV related cancers, not just of the cervix, but also of the oral pharyngeal, or of the tongue and the mouth and things like that. And so my dentist was pushing HPV vaccine from that perspective. And it's also plays a role in, anal cancers. Again, like I mentioned, for other gynecologic sites, vaginal cancers and vulvar cancers as well. And so, the cervix, yes, only women have cervixes, but these other sites definitely impact, our male counterparts as well.
Right. So it's interesting that HPV can really lead to cancer for males, females. And
Yeah,
as we talked about, you sort of compared it in the polio vaccine, but it's like there's these vaccines that we just automatically, we don't really think a lot of. We're getting our kids early on when they're
right,
little, and we don't put too much thought into them. At least
right,
and I'm like, sure, vaccinate them for all the stuff that you typically do. And this
right.
one is a little later, and you have the option, you don't have to, and so
Right.
it's interesting.
Right. Right. Now, I think it has introduced a lot of conversation around it because it is, like we talked about earlier, it's, controversial because it's a sexually transmitted infection. But I think, again, hopefully we will evolve the conversation of health to really include some of these things that are a little bit more uncomfortable to talk about. But it doesn't make them any less important. And I would argue that it actually makes it more important to talk about because people are a little bit more uncomfortable. And so to go over that hump, like you just have to move forward, and it's a medical issue.
Right. Right. Exactly. Doctor, for cervical cancer, which age do you see it the most in?
Yeah, so it generally affects younger women in their 40s, is the most common decade that we see it, 40s to 50s. And so when we're treating these patients, oftentimes they have young children. And that's why it is impressed upon us even more that the cancer diagnosis doesn't just affect the patient. It affects their young family tremendously. And so again, this is the population where we see it the most.
And what type of treatments are out there and available?
Yeah, so if we catch it early on where the tumor size is still, on the smaller side, then surgery is the mainstay of treatment. However, if it's discovered and diagnosed at more advanced stages, then treatment is generally focused on chemotherapy and radiation.
There are treatments. Well, there's been a lot to talk about, and I know that GBMC is great with any questions that have come in later and asking you those questions and getting a response, but it's been great information. Is there anything that we didn't talk about, or maybe something you just want to emphasize to people out there who are listening to this conversation, whether it be about cervical cancer or HPV or the vaccine?
I think really we've talked about a lot of things, but I just want to just reiterate, seeing your physician for young women, educating yourselves about your bodies, is really one of, I think, the pillars of self-care. Getting your vaccine, vaccinate, especially in this era that we're in right now. I can't stress that enough. And I just want to thank you for having me.
Yeah, thank you so much, Doctor. We appreciate it. It's a great conversation, and as you said, it's a conversation that needs to be had more in family. So thank you so much, and thank you all for joining us on this February Facebook Live, talking about cervical cancer, HPV, and the vaccine. If you know anyone who's interested in this topic, be sure to share this video with them, and we will see you back here next month for our Facebook Live with GBMC. Doctor, thank you again. Take care.
Thank you. Have a good one.
Bye-bye.
All right.
Are we done?
Oh,
good.
Yeah, awesome.
Thanks.
Thank you so much.
That was great. Thank you
That
so
was
much.
awesome.
You were
That's
amazing.
great. Well, thank you, Ashley. We'll miss you. Good